Otitis media basically refers to infection of the middle ear cavity. The ear is divided into three parts: the outer ear with the ear canal, and then the middle ear compartments, which basically is a chamber filled with air and other structures for vibration of sound, and the inner ear, whose main purpose is the main organ of hearing and balance control. So otitis media specifically for the middle ear, and basically represents an inflammation from various causes. Otitis media can be caused by infective causes, which most of the time, majority of children, especially for babies, could be viral related. And for our preschool and early school attenders, majority of the time is bacterial infection. Majority of children within the first 3 years of life will have encountered at least one episode of otitis media. Other causes could be related to problems with ventilation of the middle ear, which is ventilated through what we call the eustachian tube. And if it is blocking, either because of allergy problems or because of acid reflux problems, or because of irritation due to either living in a very polluted environment, and also in children who have been found that if they live with a smoker in the family, they could develop frequent infections of the ear, which is now otitis media. So those are basically the common causes that we encounter. The diagnosis of otitis media largely relies on the symptoms that the patient will present with. So for very small children, high suspicion has to be there, especially when the child is very irritable and crying unconsolably, high fevers, any recent episode of upper respiratory tract infection, and sometimes they'll either be tugging on the ear or trying to poke on it every time, and that should actually alert the medical seeing them at that time that this could be an ear infection. Secondly, also the physical examination findings. So the normal eardrum is usually semi-transparent and very thin, but with an ear infection, the changes may be to a very thick appearance of the eardrum, very reddened to the point where it loses its normal architecture, and sometimes you may be able also to see fluid in the middle ear that is just behind the eardrum as well. Okay, or even a child who has symptoms of adenotonsillar hypertrophy, like we had talked of, should also be one you can suspect to have an ear infection. Treatment of otitis media will also be guided by duration. So otitis media, as much as it is regarded as an inflammation, it can be acute, meaning a process that has started and maybe within 3 days the symptoms are there, or it can be chronic, meaning that for more than 2 weeks the infection has been there, even if there has been treatment or not. So for acute otitis media, which is one that has lasted less than 2 weeks, the child may initially be put on analgesics, which is basically painkillers, if the suspicion is this is more likely to be a viral infection, and you can have a watch and wait method where if within 48 hours the pain and fever persist, you can have a review with the child and give antibiotics if necessary. Most antibiotics used are usually penicillin based, Anything beyond that will be dictated by any other issues that you suspect the child is having. Sometimes, like I said, in adenotonsillar hypertrophy, you may need intranasal steroids, and sometimes you'll need antihistamines, especially for those with a lot of fluid in the ears. For chronic otitis media, we have those who've had chronic inflammation, so you may choose other classes of antibiotics. And also, we may find that some will have discharge coming from the ear for the period of 2 weeks. So sometimes you may have to use specific antibiotic ear drops into the ear that is affected. And the worry here is also having long-standing perforation of the eardrum, which we have to treat and see if it will self-heal. Other antibiotics may be chosen differently because either there is also recurrence of the otitis media, meaning after one has completed treatment, within a period of less than 2 weeks, another infection has been observed. This is something that is also seen in children with adenotonsillar hypertrophy, and one of the treatment options that we have for those with recurrent otitis media may involve surgery, where we may need to place a ventilation tube in the eardrum to improve ventilation in the middle ear and reduce the episodes of infection, and also removal of the adenoids, which we refer to as adenoidectomy. So surgery, yes, can play a role in the treatment of otitis media. For chronic otitis media, surgery usually is delayed until a later stage, because for some of these children there is a permanent hole that is there on the eardrum, and we need to actually close up that hole, because any communication with the external environment promotes a lot of infections within the middle ear, and of course there's the accompanied loss of hearing that is encountered. So to do repair of the eardrum usually is done at about 10 years. This is where we have less of the upper respiratory tract infections occurring in a child, and you have less chances of having failure of the repair having to be successful. The most common complications that we encounter of otitis media are usually related to around the ear. So we look at the structures that surround the ear. So the commonest could be within the ear, we could have what we call labyrinthitis, and the child could start losing balance and walking in a staggering kind of gait. But this can be resolved when the treatment of the infection is done. They could have temporary hearing loss as a complication of otitis media. Within other structures outside the ear, they could develop meningitis. It's not very common, but it can happen in some children, and especially the very young ones, like newborns, infants, and even prematures. Other things, like we said, we could have a perforation of the eardrum that is causing hearing loss as well. We could get what we call mastoiditis, where the bone that is surrounding the ear could actually be infected, and you get a swelling that is very painful behind the nose as well. And you could form abscesses tracking down to the neck if you have mastoiditis and pus has trickled out of the bone and into the surrounding soft tissues. So those will be the common complications that we encounter. Preventative measures will be very simple. If the child has allergies, then I would encourage management of allergies, meaning environmental control as well as medication use where necessary. If there's a smoker in the house, I would encourage that they be advised to either stop smoking or smoke far away from the child. And also, if the child has any other issues like abnormalities within the facial structures, then encourage to see necessary medical specialists so that you'll be prepared to deal with those issues when they come up.